a little bit on what facial fillers are, okay? And there's a difference between the two main camps, let's say, would be hyaluronic acid fillers and biostimulators. And so one of the main differences between hyaluronic acid fillers as a general group and biostimulators is that hyaluronic acid, or HA fillers for short, are reversible. Hyaluronic acid fillers are utilizing essentially the body's natural substance, the substrate that keeps our faces nice and plump, which is this kind of, imagine a backbone or almost a DNA helix type structure that attracts water to it. That's what hyaluronic acid is. So we take that substrate, we put it into a syringe and we inject it, which helps to attract water and plump up the area that it's injected into. Biostimulators, on the other hand, are a bit different. They try to encourage the body to produce and create its own tissue. So some common examples of hyaluronic acid fillers, for instance, would be the Juvederm family of fillers or the Restylane family of fillers, which are the hyaluronic acid products that are most commonly used for facial aesthetic rejuvenation. Biostimulators, on the other hand, are substances such as Sculptra or Belafil, the old Artefil, also substances like Radiesse. They try to encourage the body to produce their own tissue. They are less easily reversed, and in most cases, with the exception of Radiesse, the effect or the desired effect takes time to build up to because you're trying to stimulate the body to produce additional tissue or volume. So another very common question for people that are coming to the aesthetics field, especially neophytes to our field, they wonder what the difference is between fillers and toxins, or the difference between a filler and Botox for the common parlance. And the difference between a filler product and a neuromodulator product is that a filler product is trying to fill out a depression or perhaps a particular rhyidid or wrinkle. That's where we come into the difference between static wrinkles and dynamic wrinkles. Dynamic wrinkles are wrinkles that are created upon contraction of muscle. Muscle shrinks the area, skin bunches up, get wrinkles. Example A. Those you paralyze with a neurostimulator to smooth that area out and prevent those wrinkles from forming. Sometimes, for various reasons, either where a blood vessel is running, if you want to get into the anatomy of it, or due to repeated contraction, we can get deep lines in the face that are from that repeated motion. If those lines are present at rest, meaning not with the contraction of muscle, that is an opportunity perhaps where a filler product, either biostimulatory or hyaluronic acid, can be utilized to fill in that crevice and try to smooth out the skin. People with very loose skin or sagging overall facial shape is not a good candidate for filler. Because remember, this does not lift the face, but instead can fill, in my opinion, subtle contour depressions or areas that lack volume. Facial aging is two things. I say this in every consult. It's loss of volume and descent of tissue. Surgery treats descent of tissue. Loss of volume can be treated both surgically as well as non-surgically, i.e. with fillers. So patients who want a little more definition to the lips, who would like to have the depths of the nasolabial fold or maybe some smile lines filled in, those are great options for filler. People who want a little more volume to the cheeks, with expert care in the appropriate patients, a little bit of improvement in the under eye area as that cheek mass descends and the lid cheek junction lengthens, you can camouflage that area and create more of a youthful shape. The same goes for off-label uses such as temporal hollows, jawline. Other areas you can get some subtle, elegant contour improvements because the bony portions of the face do deflate and thin with time, and you can create a more youthful shape by utilizing these products sometimes. 6 months to 2 years is a very fair range for product to last. Some people metabolize the product fast. That is certainly clinically seen. I am not aware of any way to prejudge that or to determine if you are going to be one of those patients. But suffice it to say, there are trade-offs to each different product and each location. So where you want nice, soft, completely malleable and moldable product, those tend to last less long. And so if you get lip filler and you like the way it looks and feels, but it only lasts 9 months, that's certainly well within the normal range of how long these products can last. Whereas filling the cheek or filling the temples with a firmer, deeper product can last much longer. The way I like to think about it, when you're doing a facelift, you're building the foundation and you're building the house. A facelift does not get rid of fine lines around the mouth. A facelift does not get rid of fine lines through the skin. It's simply rebuilding the face into the appropriate shape and creating that OG of youth, okay? So it doesn't mean just because you built your house, you never need to paint the windows or clean or clear out the gutters or put new siding on the house. So skincare and filler usage for the smaller fine lines is still an important part of maintaining your result.